Regarding crow's-feet lines, actually, the site of injection is virtually the same, right? But the total doses is still, the Korean doctors prefer smaller total injection doses than Western doctors. So is it due to differences in muscle size or muscle mass or contraction strength? Or is it just a cultural thing? I don't know. But this study is quite interesting. This is actually not a medical study, but it's done by a psychologist. And upon a very happy situation, first generation Asian immigrants to the United States react a little bit differently than the European North Americans. That means that for the Caucasians, they react with intense, full smile upon a very happy situation. Well, that's good. That's true for the Asians too, but there are gaps here. Surprisingly, many Asians respond with medium smile or weak smile, even bitter smiles. So it is not anatomical. It's kind of a cultural and anthropological differences. So if their first generation Asian immigrants react in this way, and their son or daughters residing in the United States, maybe they will respond differently, I think. Well, even me, I am not accustomed and I am not trained to smile fully. Even though I try to, it's very hard for me. Yeah, but for example, you smile a lot, intensely. Yeah. So when you do a full smile, okay, our lip corners elevated, right? Thanks for the lip elevators, but at the same time, orbicularis oculi muscle contracts strongly. So that can affect the final shape of their crow's-feet lines. I think that's my point of view, but I think it's rational. So I think it's this kind of a psychological or cultural consideration should be emphasized if we really want to customize and tailor the treatment guidelines of a botulinum toxin regarding races or ethnicity. Is very important to consider the cultural things. Yeah, this is the same slide as before. As you can see, Japanese people have much less developed individual muscles of orbicularis oculi or lip elevators compared to Europeans. What's interesting is that Japanese people have a little bit relatively developed depressed labii inferioris muscle. Well, Asian people, especially Koreans and Japanese, they have a very strong mentalis contraction power. So together with mentalis contraction and depressor muscles of the lips goes this way. Okay, it's just the inverse of the full smile. So I think the orbicularis muscle itself may be different, but the cultural differences influenced much more on the guideline differences between Asians and Western countries. And regarding masseter muscle, Dr. So already talked a lot. And the first version of Carruthers guidelines, this technique was not described. But in the year 2008 version, Dr. Carruthers said that 102 points per side, starting from 5 units of Botox per side, increased to at least 20 units per side. And according to the Dr. Benjamin Asher, he said that total 30 units of disport per side, 3 points per side. 30 units of disport is such a small dose when we compare it to the Korean practices. So in Korea, the standard recommendation guidelines say that total 24 to 30 units of neuronal Botox per side, 3 points per side, mainly on the lower border area of the masseter muscle. So in summary, in Western countries, masseter reduction is rarely mentioned, but if it is mentioned, it is said that starting with small doses and increased very carefully. Well, in Korea, is a quite common procedure in daily practice. I must admit that I do more masseter injection than glabella or crossfit or frontal forehead wrinkles in my practice. I think it is not normal thing, but that's what our patients want. So I prefer this face, but my patients don't. They really prefer this kind of a very slim faces. And these are the results of the treatment. Well, 25 units of Botox or Neuronox per side. The same. As you can see, a slight sagging of mid-face sometimes matters. So in conclusion, if we think that there is really any kind of a ethnic differences exist between the treatment guidelines, it would be either intrinsic or extrinsic. Intrinsic ethnic factors could be muscle size or muscle mass differences, and extrinsic ethnic factors could be cultural or due to fashion changes or influence of a mass media, celebrities, etc. But the limitations of this type of a study is that consensus statements are usually made to ensure standard treatment result with minimize the risk. That means that there is a tendency that consensus guidelines are somewhat conservative in terms of a safety. So, and it does not necessarily reflect the very up-to-date trends. Trends in Asian countries other than Korea may vary. For example, Japan and Taiwan, Thailand, Hong Kong, Indonesia, Philippines, Thailand, they all have different backgrounds, even though everybody call them altogether as Asians. So we need further communication internationally. Thank you.